The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, Dr. Tom here. Welcome to another episode of Ageless Health live stream, and we've got a great program coming up for you today. One maybe a little unexpected of what we've been doing in the past, but one that really gets me moving, because the person that is going to be my guest is someone who I've known for quite some time, happens to be my doc as well, takes care of me, but somebody who is amazing in the breadth and width of her capacity to be able to treat people, to be able to discern. And, you talk about people who are ADD, that's not her. She's one that goes out and fishes all the data, but it puts it together in a very succinct, applicable format and applies it to some of the most notable people in the world. And we're going to talk about one piece of the puzzle that she does. She's part of the Palmer Care Chiropractic Group out of Virginia. They have a breadth and width of really quality, upstanding applications of the world that I'm in, and that's exciting for me. But this woman, Dr. Vivian Malnikof, is the real deal when it comes to so many different pieces of what I've done for years and years and years. I've had the pleasure of treating some of the top people professionally on every level throughout my years of 47 years in practice. And going back to the days when Joe Gibbs was in town, and I treated, may I say, at the old Washington Redskins, and I was the doc for the Mystics for several years. So when I see somebody who can take skill sets and apply it to these elite athletes and do it at a level that most people can't do, I get excited. And, having said that, Dr. Vivian, welcome.
Thank you so much for having me. I'm so excited to be here. Especially with you, because you've been my mentor for a really long time now.
Well, I'm flattered. Thank you very much. But you know what? You're a real deal by yourself. You have a capacity, an ability, an intuitive insight that most people working decades in our world failed to achieve, to bring about, to understand. What's first, what's next, what's last. And those things are so critical, so important when you're dealing with people, particularly when you're dealing with athletic performance. I've hung around with some of the most amazing guys. We're all in, our later times of our practice, from Dr. Evan Bladenoff down in Kansas City, who was the doc of the Kansas City Chiefs for 13 years. Dr. David Leaf, who was the old Boston Patriot doc and AC Milan and so forth. And the things that we do. But when you deal with these athletes, you can't fix them like you're going to fix somebody else if it's during season. The job is to get them back on the field so they can do what they do and hopefully hold together long enough so when you get them off season that you might actually be able to do something functional. So here you are, a female, very capable physician, chiropractic doctor with tremendous credentialing, and you're in a man's world. Talk to me about that a little bit.
I've never been asked that before. I think a lot of these guys have experiences with a lot of different physicians that are male that are a little rough with them too. I know you go about it differently because you use applied kinesiology. You're really, really specific. As a female physician, I feel like, these guys are usually like 2 or 3 times my size. And I'm a manual adjuster. I'm a manual therapist. But I come in with a softness that I think they appreciate. They've actually verbally said that to me before. They often fall asleep when I'm doing like neural therapy and craniosacral therapy. When I do the adjustments, they're so prepared that I don't really have to like manhandle them because I wouldn't be able to anyways. I think there's another big factor with being a female is that a lot of, especially with NFL players, they don't all come from like a privileged background. I think there's a lot of a lot of times there's like a emotional trauma that needs to be addressed as well. And I feel like it's really hard for men to be vulnerable with other men sometimes. It's not always accepted. So when I do, neuro-emotional technique or other techniques that address those emotions, I think it's kind of like a safer zone for them sometimes, like once we've built trust and known each other for a little while. And I feel like that really helps them elevate their game and to feel worthy of their successes. And I think it's a big deal. I love being a female chiropractor in a man's world because I feel like women can do it all too. And I feel like we just have a different perspective
Well,
with,
there's
with
a
treatment.
gentle,
Yeah.
intuitive sense that women have, my opinion, than guys have. Guys, are always taught to hide the emotions, put it in their back pocket,
Right.
and don't cry. You're a big boy now. That kind of nonsense. And so we
Yeah.
carry that on, and they carry trauma, they carry injury. Particularly a lot of the guys that are playing that sport, they grew up in some of it for them was their way out of a devastating lifestyle, but they
Right.
carry that devastation with them. And
Hmm.
they come from underprivileged homes, but now their recognition was what they do, who they are, how they position, and so forth. But many of them go back to the identity, if you will, of who they were before they got on the field, and they become self-destructive. And we see that day in and day out. So I
Yeah.
want to touch upon that one piece that you brought up. I was going to get into it a little bit later, but since you led with it, we'll talk about it. Neuroemotional technique. There's a lot of different emotional freedom technique. There's
Hmm.
a lot of pieces. I play with it with tuning forks and lasers and glasses and things of that nature, combining a whole bunch of things. My potpourri of witch's brew, if you will. But here you are, in this world, you're dealing with a guy that, um, definitely has a reoccurring something. How often, and let's, in my world in applied kinesiology, shoulder muscles relate to lung function. Lung function has to do with grief. And you look at this person and, say, okay, it's not just a neurostructural problem. This person's got something embedded emotionally. How do you, not only as a phenomenal doctor, but how do you as a female approach that with these guys, knowing that you got a problem, you're going to take out, you could break this guy emotionally, meaning you're not going to break him so he can't play, but he's going to start showing emotion that he wouldn't even show to his own family.
Right. So that's a great question because a lot of times I have to clear with them. Well, I straight up ask them, I say, we talk about the triad of health, about the structure, that they always come for the structure, and then we do some chemistry, and then I always address the emotions, and I say, you have to be okay with wanting to address them. There's multiple ways that we can do this. I do this technique called neuroemotional technique. Sometimes we need to clear being vulnerable or dealing with your emotions. And you can also do the technique where they don't have to verbally say anything out loud if they're very, very private, like I am. A lot of times you can just have the thoughts in your head and the technique still works. So they feel safe. They don't have to unleash all the skeletons in their closet. And so a lot of times I will start the technique with muscle testing them to make sure that they're congruent with doing neuroemotional technique with dealing with their emotions. And if they're not, then it might not be the best day for it. If I feel like it's really appropriate and that's like the main priority, because there's ways of testing the triad to see what is the major priority, then I'll just straight up be honest with them. I say, hey, I think this emotional piece is like what's really breaking things down for you. It's causing a lot of flare-ups. You're re-injuring yourself. I feel like we should address this. And I think deep down inside, people know when that's what's happening. And I really don't get a lot of resistance from people with it.
When you talk about somebody has to be prepared to deal with the emotional piece, it's because we present with a certain persona that is our public image. And we do that to protect ourselves, but also to make sure that people don't see that vulnerability, if you will.
Right.
And one of the things, psychological reversal in my world, is you're going to test a muscle pattern, and then you're going to have the patient repeat something like, I like myself, I love myself, I trust myself. And if the muscle is inhibited, it weakens on the testing, then you've got to reset that stage before you can even go even deeper than that.
Right. I agree.
So how often do you see that with these guys, these incredible physique, athletic, in your face? And I say that lovingly because I treat a lot of these guys, but uh, how often do you get to that place before you can open up the vortex and then actually go in and do some good for them?
I've had some clients that I only had the opportunity to see them like once, so we'll touch base on maybe one emotion here or there. But if they're under my regular care, it's like 100% of the time because it's always going to show up. Like emotions rule your life. If I see that people are self-sabotaging, I'll ask them, and we can do like core and specific technique while they're thinking about their self-sabotaging behavior. So it doesn't have to be NET. It doesn't have to be neuroemotional technique. You don't have to talk it out all the time. You can just clear the stress pattern, whether it's like an addiction or like they know they're going to get injured again because they feel like they're always injured. They feel like they can't be healthy or meet their potential. And I think a lot of the self-sabotaging, they may not even be aware of it. It's like their self-love and their self-worth. With what, like you mentioned, whatever their childhood trauma was like that unhealed like little boy is still in there. And so we have to address it in some form or another, whatever their body is receptive to.
Dr. Vivian, how did you get into to treating these guys? Obviously you live in Northern Virginia and we have, I can't get away from Washington Redskins, the Washington, whoever they are these days, Commanders, but the Buffalo Bills as well, because I know that you and Dr. Corey, that's basically home at this point. His family is there and so forth. But how did it evolve? How did a woman get into the NFL, the elite of the elite?
Um, I feel like a lot of it, well, I feel like you attract everything into your life, but I've always been a technique junkie. And so I was learning I was pediatric certified, pregnancy certified. That was kind of my specialty, like a lot of females start. And I actually had the kicker for the Redskins. His wife came to me because their first baby had really bad reflux. And so the whole family ended up being under my care. He was like the first player that I got to work with. And his wife was a Pilates instructor, which I'm like obsessed with now. She introduced me to Reformer Pilates, and the studio was owned by two of the players from the Redskins. And so I invited one of them into the clinic to see what I could do. And he was just, for me, like such a big help, such a life changer, because he showed me what was lacking at their facilities, and he was under my regular care. And then he got traded to the Bills, which my husband Corey is like obsessed, diehard Bills Mafia. Everybody knows that. Just have to look at his bumper sticker. So he started flying me out to Buffalo, and he introduced me to pretty much all his friends, all his buddies on the team. And we have a clinic out there. So they would come see me. And then I did that for about a year. And then I got into the facility, and then I got a meeting with the trainer. And then they started bringing me out, training the players during the season every other week. And then when COVID hit, they didn't want anyone flying into the facility, especially from a hotspot like Nova. So, and a lot of the guys retired or moved to other teams. But now I'm working more with like a few of the Ravens players and a lot of free agents and a lot of retired players, which I think is equally important to prevent CT and things like that, like the long-term type of things. Yeah.
So you're getting into another area that's a very dear friend of ours, and Dr. Malnikof out of Kansas. He's coming out with a new book on concussionology, if you will, in June. It's almost ready to be released. Obviously, with the NFL, if you were treating soccer players, you'd probably see more concussion problems.
Right.
But with the NFL, you're seeing these guys, and years ago they've changed the rules again. Thank God, where you can't spear with your head anymore because you're going to break your neck, and several guys did. But also put trauma, concussion into, and the equipment has changed, and it takes more impact resolution, if you will, and dissipates the impact to the head. How often do you see a concussive pattern that is subtle early on in their career, and what are the keynotes? How do you find them? What shows up?
So I see it all the time, pretty much. I would say almost every player from like probably like college level on up, especially if they haven't received care. And I base a lot of that off palpation through craniosacral and neural therapy, which are both osteopathic techniques that I have a lot of training in. So it's based off feeling, but you can feel the rhythm of the craniosacral pumping mechanism. So all your cranial bones, like people don't realize that they're not fused, that they move with respiration, and they should be synced up in a specific pattern. And it affects the way that the cerebrospinal fluid is flowing, and taking away waste material and being pumped back up and bringing nutrients back to your brain. A lot of things with the CTE is that, that there's that buildup of the protein, but that buildup is from the trauma and from the stagnation of the fluid. And so you can feel the rhythm and you can feel the restrictions when you do those osteopathic techniques, and then you can release them manually. It's really gentle. There was a study done by, why can't I think of his name? Ricky, I'm going to butcher it. A former NFL player. He did this whole big concussion protocol program with the Upledger Institute, and they proved that like pain levels, memory, like all the things that go along with head injuries and concussions, like everyone improved across the board. So there was a big study on that as well. But yeah, I see it all the time. I base it off palpation. I think the adjustment is like super, super important because it's literally like flushing. You release the toxins and the fluids, and then if your neck isn't properly aligned, then it just doesn't flush properly. And so I feel like the adjustment is really critical as well.
Well, you've got 22 bones that make up that noggin, that protects the brain. And they're little saw teeth interdigitation, so they can get jammed pretty easily. So that constant trauma, that impact, that compression can cause it. But it also indirectly as well, a lot of these guys, even though they're the professional athletes, they don't lift properly. And so if they increase their interthecal pressure by holding their breath when they're doing something, and they're overloading, particularly when they're doing max one set where they take it down about 20% off the bar and just hold it till they start shaking. Often you'll catch these guys holding their breath, and it locks up all of these cranial plates. And so now you've got a spinal fluid problem that begins to show other types of problems. So do you use your work? How often would you refer them into doing other types of decompression therapies? Anything that, you're going to put them in a unit and you're going to decompress the whole body. There's multiple pieces. That's why I'm letting you decide how you want to go after that. Or do you find that the resolution doing cranial manipulation, going in and opening up the suture plates, handling the pump handle, the skull, the mandible, is that enough? Is that sufficient? Can you get them back to normal? Can those aberrant proteins that begin to form, the amyloid and the tau proteins that come from trauma, do they persist or do they go away?
That's a great question. Not that I've ever been able to measure something like that. And I don't even know if it's like possible for them to measure the amount of proteins. I know just based off of how kind of they're feeling and what I'm feeling, and when I'm testing their cranial nerves and testing improvements that way, that I always see improvements. If they have a fresh concussion, though, I recommend supplements. I recommend doing the hyperbaric chamber. I recommend, staying off anything that is like a stimulant that's going to aggravate it. And so there's lots of approaches to it. I think in the beginning, sometimes like less is more. So I like to use the really gentle techniques. And I've gotten so many players off the concussion protocol, and some that were on it for months. Like sometimes, like I had one guy that was on it for, I think, 6 or 9 months. He could not clear the protocol, and he had like 8 or 9 diagnosed concussions. Like he should have retired, right? But he wanted to play another year. And he finally came and saw me based off of a referral, and he was stabilized, and he cleared the protocol that week. And it had been like more than half a year that he couldn't clear it. His eyes couldn't stabilize, he couldn't track. So I did craniosacral and neural, and then I added quantum neurology, which, I do a lot of. The nerve rehab is critical for players, I think.
Yeah, because what happens often is that the memory of the cranial nerve expression is lost because of the injury, the trauma, because of the maladaptation. And if you don't re-imprint it, if you will, get it to remember what it used to do. And that's the beauty of quantum neurology. And, I've had the conversation with George repetitively, that's really what you're doing. And you're getting it to say, oh, yeah, I'm supposed to be doing that. And then all of a sudden, everything starts kicking in on a functional level. But the traumatic, there's actually been a couple studies that I recently came across where they were measuring the different neurotransmitters. And it's easily done, by the way, with a urinary test. And they're seeing, obviously you have excitatory and you have inhibitory neurotransmitters. And so what they're seeing is a lot of the excitatory neurotransmitters are so out of balance, you're getting this aberration where they can't settle down and refocus. And you're getting a lot of the inhibitory neurotransmitters that don't work anymore, like GABA and serotonin and so forth. So, but with treatment and with the kind of work that you do, and with hyperbaric and laser therapies and things in combination, hand in glove, they see a resetting, if you will, obviously with supplementation, but it's not a permanent supplementation, and an upregulation of these neurochemistries that allow I'll use the word presence. They're back, they're functional, they're intact with their job, because a lot of times they have to quit because they actually lose the capacity to remember, if you will, quickly. And that's lower brainstem, that's a lower part of the brain, the cerebellum. And that's where a lot of the traumas come from, because of the hit and when they snap their heads back.
Right.
So, it's amazing to watch, particularly your reputation is extraordinary when it comes to dealing with these people. And I watch you on the internet all the time, and I sit there and I smile and I said, yeah, she's good to go. But talk to me a little bit about, not only these elite athletes, but how much of the same type of thing do you see on normal Joe that walks in, and what are other sources of trauma and injury and impact that presents as if, you have a concussive pattern in front of you, and what else could they come from?
So definitely falling, tailbone injuries can cause concussions as much as actual head injuries. You see a lot of other sports traumas, but whiplash injury, like everyone's pretty much been in like some kind of small or big car accident. So you'll see a lot of that as well. A lot of repetitive stuff. I'm also seeing a lot of neurological stuff with all the technology that we have, all the EMF. You're probably seeing it too, how it's affecting how people are wired. I'm seeing a lot of primitive reflexes coming back on people because we just have excessive like trauma and stress, whether it's like, a micro trauma, all these primitive reflexes that, the babies, every baby's born with it. Most of them should extinguish within a year, some of them within like 3 years. And I've been rehabilitating and integrating them because they keep coming back on people. The stress from the pandemic and just like the uncertainty in the world, like a lot of people are in that part of their vagus nerve, the dorsal part, where it's freeze paralysis. They've like surpassed, fight or flight. They could not sustain sympathetic anymore. So now they're just the frozen goat, like where they're overwhelmed, they're indecisive. They can't deal with people anymore. And like, I feel like everyone was kind of in that state. It locks up your entire sympathetic chain. So like T1 through 12. So people are just like tight and irritated and can't deal with life. And so I do that reflex. I check it on pretty much every single person. And then if they get in another trauma, I check it again. Or if I feel like they're just like not handling life well, I check it again. Or like the Moro startle reflex, that comes back a lot with with everyday like emotional trauma. And there's all these other reflexes that are so great for things like learning disabilities, for potty training, spinal galant, for sitting still, for food sensitivities. Like people don't realize that the hands are linked to food sensitivities. The palmar grass reflex when, the baby like grabs your finger, so that can come back. And, if you've had a trauma to the hand or the foot, like all these different reflexes can come back. I feel like that's really important too. What was your question? I got sidetracked.
You went well. Injury patterns get embedded in the nervous system, regardless of what part of the body it is. And anything, it can happen. And when we talk about injury, it can be not just a traumatic injury, a fall, a blow, a punch, or whatever it is, but it also can be an injury from biochemical or neurochemical irritation. We're seeing a lot of things in the post-COVID world. And the spike protein, either from the virus itself but specifically the vaccines that way too many people, in my opinion, have had, are showing up with very, very detrimental and devastating neural connective patterns. They have a bad habit of going into the lower brainstem. They have a habit of going to the mesenteric apron. They have a habit of going into the heart, but they're also going into joint spaces. And they're activating, particularly these vaccines. With the study came out of Saudi Arabia in the middle of COVID. These vaccines were activating the expression of underlying viral components: Epstein-Barr virus, cytomegalovirus, herpes virus 1 and 2, even AIDS, and so forth. And the list goes on. They're all enveloped type of viral patterns. And so we're seeing that presentation, and just, people come in and say, you have a patient that presents with neurological disorganization, if you will, and they can't figure out what happened to them. So I'm going to roll it back just a little bit with your NFL players, because most of the teams had mandates that they had to have the vaccines. How much of that are you seeing in opinion post-COVID, post-vaccine timeframes are exacerbating a lot of the things that you're looking at with these elite players?
Yeah. I will say, just so that we don't get in trouble, they weren't like mandatory on the teams, but like they made it pretty unbearable for people that spoke out against it. There was like a low level threat, like you weren't being a good team player, and the fines were like ridiculous if you didn't have your mask on properly, like all that BS. But anyways, just to get that covered. But yeah, I see it. The injuries have gotten way worse over time. Like the recovery has been slower. I feel like the inflammation factor is like out of control. I am seeing a lot of cardiovascular issues where during the off season, I had a ton of players on supplements, which, I traced back to the vaccines that they had or the booster. So we've been doing like a lot of neurological rehab for the heart, a lot of vagus nerve rehab, a lot of supplements to support, a lot of detox. So I am seeing it a lot. And I feel like the injuries have been so amplified across the board with, like seriously, like all these young athletes that are super, super physically fit and they're having heart attacks or going to cardiac arrest, like,
Does make sense.
It doesn't make any sense. No. It does to us, but
it does.
But yeah.
I'll take the blows on this one. So you're just answering questions. So you got a lot of years left. So one of the things that we've been finding, not only with the athletes, but with a normal Joe that walks into the office, is that they're complaining that they don't have the push in their feet walking upstairs anymore. And these are people that were in fairly good shape. They would park the car as far away from the building as they could. They walk up the stairs to their office. They walk up the stairs to wherever they were going. And now they're finding that their calves are not holding the way they're supposed to. And there's a lot of numbness and tingling in their feet. So curiously, that's my brain works in kind of odd ways. And I'm saying, okay, in my world in applied kinesiology, there's a muscle known as the second heart, and it's a soleus muscle. It's just underneath the gastric. It's the calf muscle for those who are listening. And the soleus pumps blood back to the heart so it can be reoxygenated. And then it's sent back out. What we're seeing is because the heart is not working the way they're supposed to, the soleus is not firing the way it's supposed to. So it's causing a reactive pattern, if you will, between the gastroc and the soleus. So they sit on top of each other like this, and the soleus is on the bottom side. And if to treat that, you got to treat the heart neurologically, as you were talking about. You have to reinstitute its memory, providing that there aren't other things that are still there, and you have to get rid of those first. You have to bind the spike proteins. You got to get them out. You have to do that kind of nonsense. I don't know if that's shown up with any of your players where they've said, I don't have the explosive off the line anymore as they used to. What's going on?
What you're seeing a lot more of the foot and the calf and the blown Achilles, like, across the board. Like, how many NFL players have torn their Achilles like this last year, right? Like big players. And so I was just going to mention the soleus, because I always tell my players that they cannot ignore that muscle, that it sits under the gastroc and it forms a lot of adhesions as well. And I always talk about its connection to the heart and about how much it's going to affect their athleticism and their power. And so we always address that. But I like that you pointed out how the connection with the heart. So yeah, I always check the soleus anyways because they're athletes, but it makes more sense now. Like, now that we're talking about it with the Achilles. Yeah.
Yeah. And the interesting point that also it seems to be related to that, because it affects the covering of the heart, is pericardium 6. And anytime that you have the pericardium surrounds the heart, attaches to the diaphragm and helps things move, we're finding that's involved, and we have residuals of, if you will, the spike proteins that occur that are locked into that. So for whatever it's worth, it'll drive you in another different direction, make you crazy for a while. This is fun. I could sit here and talk to you all day long. This is like cool. And again, I want to publicly thank you for pulling my butt out of trouble about 4 years ago. And, those who have been listening to the program know that, there was an interesting trauma that occurred, if you will. My hip went into AFib after a car accident, and we're in the middle of COVID. And I was, in the office 24/7, like we all were, trying to keep things stable and help our patients and recommend what they needed to have. And 6 weeks to the date, my heart stopped for a moment, and I smashed my head on the floor. And, it was interesting. Matter of fact, it was kind of funny. If you talk to Dareth, who you know very well, that works with me, I'm in the hospital. I'm in the ER, and I'm in bradycardia and AFib. And after they figured out that I didn't have a brain bleed, they wanted to put a pacemaker in. I said, I don't think so, not happening, But anyway, I'm on the phone, and who am I texting? I'm texting your husband. I said, Corey, who do you know that's a good neuro guy? Blah, 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 right? Dareth is in there, and apparently she gets a call from Corey, and she says, what? He's in the ER and he's texting you? Anyway,
that sounds about right.
Thank you for taking care of me. You made a big difference so I could function. And then obviously, the journey. It took a while, but I got back, and if it hadn't been for you, I probably would have gotten there. But I appreciate it. And listen, we're going to do this again. We'll pick another subject that you're great on, and we'll do that. But thank you so very much. And thank you for being you.
Oh, thank you for being you. I love you so much. And Sue and Dareth.
Take care, my friend. We'll talk soon.
Okay. Love you. Bye.
Bye-bye. When I get to meet amazing people who are at the top of their game, who have the capacity to do things that other people are just thinking about, but they take action steps, it's always exciting to me, because I then can learn from them. I can apply it for other doctors that I teach on an ongoing basis. And that's what happens when you meet somebody like Dr. Vivian Malnikof. She's an amazing person. She's a tremendous knowledge source on a lot of different subjects. She's as ADD as I am when it comes to looking at different pieces of the puzzle, and I appreciate that more than I can possibly tell you. Hope you enjoyed the program. Remember, we'll continue to bring this. I'll have her back on again at some point, and we'll talk about something else that she's passionate about, but she's a very passionate woman. Remember, I do this program every week and our radio program at 105.9. And remember, June the 12th at the Roselle Center for Healing in Fairfax, we're going to be doing a night on fibromyalgia and chronic pain patterns. Don't forget to sign up because, it's going to be a very popular program. We're going to show you how to get out of pain. We're going to show you what to do to make life a whole lot better, for yourself. So be there. You can call us if you want to at 703-698-7117 or go online at drtomroselle.com. And by the way, please tell all of your friends to follow me on all the social media platforms. And if you don't, do it now. And so we can get this message out to as many people as we possibly can. And remember, one motivating fact for me is simply this. I love you all. Have a great day.